All right. All right, guys. Well, what we're going to go over today is pretty much how to train through lower back pain. This is going to be more of a training discussion, less of a discussion on like exercises to actually help your lower back pain. This isn't going to be a physical therapy talk. This isn't going to be anything that's going to treat anyone or diagnose anyone. This is going to keep people exercising, keep them training through any lower back pain that they might have. So let's get going. And next slide, there it goes. So, I think the first thing that we think about with back injuries, one of them being just disc herniation is probably one of the most common ones that we'll see. Second one probably being just like a muscular strain, erector, QL strain. We'll have some like nerve issues, sciatica, things like that. Also, there's like a lot of different spondy cases as well. There's like 3 or 4 different spondy cases. These are all like small little pars fractures in the spine as well. So I think there's lots of different problems that can be back pain, which is why, again, early on, there has to be an initial screening process and initial assessment to help identify and make sure that we're not having a nerve issue that we think is a muscular issue. We've all probably seen this guy right here doing a round back deadlift, about to blow his disc out in the gym setting. But I think there's lots of causes of different lower back strains. So I think we'll kind of get into some of the causes next. There we go. Before that, I want to just highlight some stats that I think are pretty cool. And I was talking a little bit earlier that when you do a quick Google search with just like back exercises, everything that comes out is just awful. From an exercise standpoint, from a stretching standpoint, I think we could definitely do a lot better with just some general information and some general data. But here's some boring research. If anyone really cares about this stuff, this helps kind of guide, I would say, some more of the PT treatments. But there's a lot of people that have back pain. 8 out of 10 Americans will have back pain at some point. It's probably one of the most common lower back or just common injuries that people have. And when you look at injuries, a lot of people go right to like, oh, I should get an MRI on my back. Actually, there's some research out there that probably like most people, and actually most 52% in this one study of asymptomatics who are having any back pain, half the people will have some sort of disc bulge on the MRI, which just goes to show that like even if someone walks into the gym, they probably, look at these first 2 stats, 8 out of 10 and 50% of those 8 out of 10 will have had some sort of back pain, even though they're not in any pain. So as a coach, if you're looking at the stats, you have to assume that most people have had or will have some sort of disc herniation. So you have to have that in the back of your mind when you're writing someone's training program. Some other interesting studies looked at just like hamstring tightness. I have a couple stats on that. Like, a lot of people go to like, oh, your hamstrings are tight, like that's causing your low back pain. That's actually not true. If you look at some of the research out there, it's not really correlated with some of the back pain people that were in these studies. So we probably shouldn't be doing a ton of hamstring range of motion exercises or stretching, if we think that's going to help our lower back pain. All right. So why do we hurt our back? I think there's a lot of reasons why we hurt our back. One being just like again earlier, like we've seen that one rep or that one bad rep deadlift, that way too heavy exercise where someone hurts their back on. There might be some sort of contact or a singular event that you remember hurting your back. Or it could be just like the straw that broke the camel's back, where like you sneeze or you bend over to touch your, tie your shoelace. Like we've all heard those stories. Could also be poor mobility, poor range of motion of the hips, of the ankles, that could be causing pain in the lower back. Could also be poor stability or poor control of your spine. And I like that for these three pictures. Like, if you look at these first two pictures, like, he can't control his spine right now. Like, it's really rounded in that first picture. Going through that second picture, likewise, he can't control it. He's relying on passive stability. It's really overextended. So that's not good either. Whereas you want to try to find that good middle ground and try to maintain that middle ground for as long as possible, right? And then like lifestyle habits, like smokers and other lifestyle habits, drinkers, like you're gonna have a higher risk of injury for those if that is your lifestyle. Also being like your job, your work, what do you do on a day-to-day basis? All these things are going to impact someone's injury. Poor exercise technique. Obviously, like if you have poor technique, you're going to have pain. You're going to feel the muscles in your back working, which isn't something that we should be doing very often. And that's something that we can control is poor exercise technique. Too much load. We've all seen like the bro try to load up the bar and just like try to squat a house, and he ends up hurting his back. So like you have to manage the load and kind of slow cook the person to not only maintain health, but still receive a good training effect. And I put that last one, imbalances. Like that's kind of a loaded statement, like imbalances of just like muscles that are too active or aren't active enough. So there's a lot of things that can go on in the body that might impact that. So you have to try to manage your balance, manage your airflow. There's a lot of things that kind of go into that one. But to sum this one up, there's a lot of reasons why we hurt our back. And it's not always simple. It's just like, it might be that one rep thing, but it's usually a multifactorial thing that you have to kind of manage. All right. So let's say someone just hurts their back. Let's say they see someone like myself, a coach. I see them, my back hurts today. Following that sentence up with some sort of evaluation is probably key. Talking to that person, understanding what might have caused that pain, I think is something that has to be done early on. And that's the time where you might refer out to a PT or you might refer out to a chiro. So you have to try to figure out like, okay, what does this person need and when do they need it? Talk to the client. Like if it's someone that and that like they usually don't complain very much, and they're complaining of something, like it's probably something serious then. So just like talking to your clients, getting to know them is going to go a long way. At that time is probably when you should, definitely have communication with your physical therapist, your chiropractor, or your doctor. Just so everyone's on the same page. If they need imaging, if they don't need imaging, if they need therapy, what's the therapist doing? What's the strength coach doing? What's your trainer doing? So you can have better outcomes for that person. And also like, I think educating the athlete on like what to expect going forward is key. Like, hey, like it's, give them a heads up, like it's probably going to hurt over the next couple days. We'll probably recommend X, X, and X. We're going to have it's going to be a roller coaster road to recovery, good days, bad days type thing. Just educate them on like, what might have caused it, and probably the most important thing is like, okay, what are we going to do about it now? How can we change what we're doing to have positive outcomes for this person? All right. So like, how do we still exercise if someone comes to you or they have lower back pain or you have lower back pain? What I try to do is focus on like the positives of what they can do. Try not to say like, oh, like, you're not going to exercise, like completely rest. Like throwing blanket statements out there like are very negative things to someone, especially for an athlete that likes to be active, that likes to be doing stuff all day long. You want to focus on the positives. Tell them what they can do. They can go for a walk. They can do, we'll go over some of the do's, but like from an exercise standpoint, there's lots of stuff they can do if they just have some lower back pain. Obviously, like gather, what the PT or chiro is going to be recommending, that we recommend this, and this, and then you implement that into your training program, and that can be all different things depending on the injury. So you definitely have to communicate and work together with your network of people to have better outcomes for athletes and for yourself. I think the other thing that we want to try to focus on is we need to try to maintain some sort of training stimuli while you're in some sort of back pain. That's key because we don't want to just decondition the athlete. So trying to find something that they can do, it can be anything, just from like mobility, light mobility, aerobic training. Find something, find a training stimuli that you want to attack, and still keep them doing things. And I think, like, especially from the coach's side, also from the athlete side, like, be okay with good days and bad days. Like, know that, like, hey, if you implement something, it might feel good that day, but then the next day it might not feel good, and then the next day it might feel good. So just, like, be okay and be acceptive of, like, having a good workout and having a bad workout. So, like, here's some programming things that I usually don't do for just some general lower back pain. We try to avoid, like, bilateral loaded kind of exercises, benching, where you're if you look at that picture of myself, like, I'm in lots of extension. I'm close to my end range. End ranges of range of motion might cause a lot of pain for a lot of people. So, like, trying to, again, find that kind of neutral, that middle ground, is always the way to go. Bent over rows, like, just like a tough exercise for the lower back. So, like, probably not going to be programming that from an upper body programming standpoint. You're kind of in that, like, hips flexed, bent over position. Not something that's going to feel good for a lot of people. We're just kind of hanging out there under load. So avoiding some of those, like, heavy bilateral benching and rowing exercises, probably not something that you're going to be doing. Also, just like any rotational kind of frontal plane twisting exercise, it's probably something you're not going to be doing for someone that has some sort of lower back pain. Any rotation isn't going to feel good. Anything quick, sprinting, power drills, speed stuff, not something that's going to feel good for someone. Need to keep exercises, somewhat slow, adding tempo, and taking out those, like, power drills where, like, just think of a vertical jump. Someone coming up out of a vertical jump, they're going to naturally go into some sort of extension. That's not going to feel good on the back. So kind of limiting the program a little bit, not programming these sorts of exercises is something that I would probably recommend. From a lower body standpoint, so definitely need to limit heavy, sagittal plane based deads, squats, Olympic variations. No, like, speed or dynamic effort days. Those are things that you just got to kind of cut back on, that are going to cause a lot of pain for a lot of people. So, like, limit, like, in this picture, like a one leg RDL, like that's a tough exercise that might cause, your erectors are going to be flexed in that position. Like, so if you have an erector strain, like, probably not something you're going to be doing. So, like, you limit those, like, exercises that have a high, stability demand, like sometimes doing, like, a lot of single leg squatting or, single leg RDL variations where you're on literally one leg, like, it's tough. It's tough for people that have lower back pain. All right. So, like, now what do we do instead of those exercises from an upper body standpoint? Instead of your bench press variations, hammer, like, push-up variations, as long as they can handle that, like, kind of prone position, push-ups should be good. Upright, like, standing cable row variations are definitely the way to go. Instead of, like, some, like, bent over 3-point row variations or things where you're in that, like, flex position. Things where you're upright, TRX rows are definitely some recommended exercises from an upper body standpoint. This is a good time to work on some arm care. So crushing arm care, getting some kettlebell carry variations, things like that. Upper body mobility, range of motion. That's all things that you can do to help, still receive some sort of training effect through the upper body. Lower body, again, I'm assuming that you're in some sort of PT. So, like, the PT is probably doing a lot of lower body training or a lot of lower body exercises, but you can still do some things in accordance to the therapist. Some of the go-tos for me are just, like, split squat lunges. Those usually are, like, super back friendly, like, first just, like, upright, up and down. There's lots of variations of that that you can do. Hold a light goblet, body weight, whatever it might be. You know, some glute bridging variations are usually pretty back friendly. And then just like lower body mobility, you know, crush some of that. And then like depending on the intensity of the injury, like, you know, lower level, I'm going to go over some progressions of squatting and deadlifting, but like some lower level squatting and deadlift variations usually are usually pretty good to do, you know, depending on the severity. All right. So like, how do we get back to like some kick-ass training? Because like, that's what we all want to do if we have some sort of lower back strain. And like squatting and deadlifting are some of the foundational exercises that people want to be doing. So here's some of my progressions that I like to kind of get people through if they're returning from a lower back strain or a herniated disc, or maybe they have that in the past. You know, we want to regress them to a variation. You know, a lot of these variations are awesome to do. You know, it just depends on the person's tolerance, where they're at from a strength level, where they're at from a training stimuli. You know, so we'll use these to get people back to, you know, doing whatever level of training that they were doing. All right. So I mentioned some like hip mobility exercises. These are some ones I like to do to help people through that lower back pain. Because a lot of times you'll see lower back pain, the hips are going to tighten up, or the hips are tight first. That might lead to that lower back pain. You know, so having good hip range of motion is going to help that person move more efficiently through the hips and not move more in the lower back. You know, a lot of times like the lower back just kind of takes the beating for the hips not doing what they're supposed to be doing at the right time. All right. So some general hip cars are pretty much like a hip circle. You can do these on your hands and knees. You can do these standing. You know, these are great variations to help increase the range of motion of the hips actively. That shouldn't cause any pain in the lower back. Some other ones that we'll go through are some PAILS and RAILS. Now that's just a fancy term for just some isometrics. I'm gonna go over these in my next slide. But these are great to help improve some hip internal and external rotation of the hips. And we'll also do some positional breathing exercises. These are great exercises to help kind of relax the erectors, help move airflow to different parts of the body, to help with that person's range of motion and mobility. All right. So here's just some quick photos of some PAILS and RAILs. The first one on the left, where I'm leaning on the couch, that's for hip internal rotation. Pretty much how you do it is drop the knee down as far as you can without losing your sit bone. So you need to feel kind of both sit bones on your butt. Drop the knee down, keep the foot flat. All right. Hold that end range for 2 minutes. You're holding your like a passive stretch for 2 minutes. After that 2 minutes, you're going to press your knee into your hand for 10 seconds as hard as you can, and then pull your knee away from your hand to the ground for another 10 seconds, and then hold that new range for 2 minutes. So that 2 minute hold is that second picture where I'm holding that knee in that new range I just pulled into. Okay, it's a little uncomfortable at first, but it's great exercise for increasing active hip internal rotation. Same kind of programming for hip external rotation in those second pictures. I'm getting to my end range over my knee, like my trunk is as far as I can forward. Feeling a good glute stretch there. Press the knee into the ground for 10 seconds, and then you pull your trunk over for another 10, increasing some hip external rotation on that left leg there. So these are great drills for people to do. I like to program these, just like send them home with this. You know, it takes a while to do. Might program it towards the end of a training program. But for anyone in lower back pain, like these are pretty simple to do that shouldn't cause any more pain. Core training. So like everyone thinks like, oh, my back's weak, my core is also weak. So like a lot of times, like I don't really like the words weak and strong, because that signifies that like we have to do exercises of the back to strengthen it, right? So like a strong back isn't what you want. What you want is mobile hips and somewhat relaxed erectors. Now, relaxed erectors also can think of relax as just like kind of turning off or you know, something that's not always flexed, right? You know, so usually people don't have back pain because their back muscles are quote unquote weak. they have back pain from a muscular standpoint, if it's a muscular injury, which is probably the most common injury that I see, is usually due to the overactivity of the back, where the back's actually too strong. It's too active. So you can kind of combat that with some general core exercises. Now, core training is training more of the muscles on the front of the body, your abs, your breathing muscles, and that's kind of how you start off a core training progression. These are some things that you might do in a therapy program. These kind of first two dead bug variations, positional breathing exercises. That's one, and that photo there, where your feet are up on a bench, kind of digging the hamstrings in, getting the pelvic tilt. Those are great exercises, kind of low level if you might still be in a little bit of pain, to help start training your core. Then you can progress to more, prone-based exercises, planks, shoulder tap variations. These are all things that you can add into someone's exercise routine to help reduce any sort of problems or pain that might be arising from lower back injuries. Then you want to get them like half kneeling or standing or paddle off variations, chops and lifts. That's kind of what Brian's doing in this photo there. These are great exercises to train your core. They are also tough. So these would probably be some of the last progressions that we would get to if someone's kind of progressing out of that back pain. And these are exercises that we do for people that are healthy too. So these are just good general exercises that probably most people should be doing. Just a quick summary. I think if someone has some sort of lower back pain, you need to slowly increase the load. Don't jump right back to the load that they were doing in their squatting or deadlifting or their roof or elevated variations or their bench press variations. So it's kind of slow cook them back to where they were. And I think what's key is early modification. So someone comes to you day one, day two, okay, what are you going to tell this person? How are you going to help this person? And let's nip this in the butt before it becomes my back's been hurting me for 2 weeks. And you don't want that. You want to nip it in the butt, get it early, make modifications, make the right recommendation, send them to a PT, whatever it might be. And just communication. I think that's key. Communication with the baseball coach, the strength coach, the trainer, the therapist, the doc, the athlete. Make sure everyone's on the same page. Because what you might be doing in a therapy program, you don't want to overlap in the strength program. So just making sure that everyone's on the same page is key. And again, I spoke to this earlier, just set expectations. Make sure the athlete knows, what they're going to be going through this lower back pain. I can speak just from you can give recommendations I also had back pain, these are some things that I felt, kind of make sure that they understand that hey, it's okay to have lower back pain, and try to just relate to them and set expectations of what the road to recovery is going to be like, what their training program is going to look like. Let them know that everything is going to be okay, et cetera, et cetera. So just kind of, those are, I think some things I wanted to highlight, realizing that each case is different. Each lower back pain isn't always the same. You have to kind of tailor your program to the individual, tailor your program to what's going to help this person, bounce back as quickly as possible. So I think that kind of summarizes my thoughts on just some general lower back pain and how we can, combat that as a team effort going forward. I can definitely open it up for some questions, comments, thoughts, experiences. If anyone had any lower back pain, we can definitely share that now. I can definitely share some of my stories too. I've had some back pain, through various reasons why. I think part of my issues might have been just a for me, definitely, if I have lower back pain, it's probably because I have poor mobility in my hips, right? And my hips aren't moving the way they should be. I'm not doing the right exercises in my training program to maintain my hip mobility. So then when I go to do something dumb around the house, I get lower back pain. Nothing severe that's going to limit me, but definitely something that's going to require a change in the training program. Lower back pain stinks. It's not a fun injury. Really, sometimes can limit, what you're doing on a kind of day-to-day basis. Just simple things like sitting down on the couch. Like sometimes like your back pain's so bad you get a spasm, you can't sit on the couch. Can't get out of the couch. It stinks. So I think just finding ways to stay active for me are important. Things that I can do that feel good through that painful time, or things that I try to do to stay healthy, stay active. But yeah, let's kind of open up for questions, comments, concerns. Let me stop my screen share here. So yeah, guys, any thoughts, comments? Feel free to unmute and throw them at me.
Hey Rob, thanks for taking the time to do this. You mentioned early in your presentation about poor control of the spine and how that could be a contributing factor to low back pain.
Yep.
As a coach, how are you coaching one of your athletes to learn how to better control their spine?
Yeah, I mean, that's poor spinal stability can act up really in any exercise. So it really depends on the exercise. I would say if we're sticking to, like a deadlift or a squat, it's just teaching the athlete like where they're at in space. Having them understand if they're extending or if they're flexing. And learning how to brace and control your spine through exercises is probably something that we're focusing on through an exercise standpoint. Lower level exercises can be anything from just learning how to completely flex all segments of your spine, learning how to completely extend all segments of your spine. So there's some things that we might do in a warm up if someone's having trouble, just moving their upper thoracic, where most people just hinge at this like TL junction and their lumbar is stuck. They don't know how to move or flex their lumbar spine. It's very common. And so teaching that is tough, getting them to understand where they're at in space. We'll use a lot of different techniques. It just depends on where they're at and what exercise they're doing.
I had a question with baseball being so rotational. You mentioned that earlier. You said that like those rotational exercises are things you're going to try to limit early on. How do you go about talking to guys regarding like monitoring or changing what they're doing from the baseball side of, hey, don't throw for a little while, or don't hit, or like what's kind of your guidelines there?
Yeah, I mean, that's sort of something we were going to rely on the therapist as well. Since it is very rotational, definitely like first thing I would probably do, and so much exercise, it's just like lower the intensities. So like no high intent throws, no bullpens. Limit things that are going to cause, we're going to have high rotational velocities. So like those are the first things that come to mind for me, are just like cut back on the intensities. If you're long tossing, cut back on the distance, things like that. Maybe like certain drills that might have high rotation component in it, like a pivot, like a pivot pick might be something you might need to think about monitoring or taking out of their training program for now. I think just like having them try to swing and throw, because I think that might help them feel like they're maintaining, they're still, from a mental standpoint, like they might still feel like an athlete. So, finding drills they can do, there's things that I would probably recommend too, whether it's, more video breakdown, you're just getting away from maybe throwing, maybe just breaking down old video, things like that, or some things that I would probably, talk to the athlete about, and, just have them try it out, see what feels good and see what doesn't feel good, and take the therapist's recommendation. Cool.
I got one more for you. How do you feel that the volume of swings guys take play on potential back injuries?
So
it's like
yeah, I mean, it's definitely there. I think as long as they build up properly, just like anything else, if you progress properly and you're able to handle the high swing volume, I think it's probably okay. Where it's not okay is if you rush back too quickly, if you have poor hip mobility and you're trying to swing and get into your front hip and you can't get into your front hip and you're going to compensate in your lower back, those would be some red flags that I would look at for someone in an assessment that might say, like, hey, like this person, has some really limited hip IR on that lead leg. Like we should probably hold back on some of the volume of the swings. And like the swing coach probably will see that. They'll probably say like, hey, like, yeah, he's really extending as he swings through the zone. It's like, okay, yeah, like he's probably going to overuse his lower back at some point. Same thing from the throwing side, I'm sure, where if you're going to see, we see limited mobility all the time in the hips, it's going to impact the way that they play their sport. So I think just managing that person from a volume standpoint, very similar to what in the gym, is probably the best way to go about it.
Yeah, I'm with you there.
Yeah. Cool. Gabe, Barrett, any other questions, comments?
Hey Rob, how you doing?
Good, man.
So I've just been with you recently. I've joined your workouts in the morning, and so yeah, thanks for doing this and everything. I had a question from a pitcher standpoint.
Yeah.
So when I'm pitching, there are times where my lower back just feels like there's either just like a crack that I can't get, or it's just extremely like just tight.
Mm-hmm.
Can that be because of overuse of the lower back when pitching, or poor mechanics, or is there any way to really identify why that specifically happened when I'm pitching?
Yeah, I mean, I would come back to the initial assessment, Gabe, and just try to identify like, hey, what's going on? What are we seeing from a mobility side? What are we seeing from a pitching mechanic side? It's kind of the chicken or the egg. What's causing your poor mechanics? Is it bad mobility or is it just bad mechanics? So I think, and I think George can hop in on this too. Like, I think we see a lot that it's usually poor mobility leads to poor mechanics.
Yeah.
That's probably the most common thing that we see, but not always. So, if your lower back's feeling tight, that's a very common thing that we hear. And when I hear that, Gabe, the first thing that kind of comes to mind is that your lower back erectors are literally like rods, and they're flexed all the time.
Yeah.
So you're overusing.
Yeah, I can definitely relate to that. Yeah.
You know what I mean? Like you're overusing your erectors. So why are you overusing your erectors? Possibly because you're in an extended posture. That just means like you're very arched. Similar to my picture earlier in like the bench press, where just you're very arched. That can cause some erector discomfort.
Okay.
So managing your extension is some things that I would recommend. How do you manage your extension? Can be done through a general training program, positional breathing drills, things like that to help kind of bring you back to more of a neutral position. Try to maintain that position through your exercises. And if you feel it during any exercises, that's definitely something that you need to kind of look back to and see where your kind of hips are at. I'm going to try to stand up and give you a quick little pelvic tilt position. Like if your lower back's here, that's going to place a lot of stress on that erector. And if you're doing exercise, if you're doing push-ups, like you need to be in more of a neutral position, if you're doing lunges or squats, we don't want to be just like squatting like that. So, just trying to maintain that as best you can. Through this time, it's tough, but, do the best you can and, probably would recommend a full eval. And George, I don't know if you have any comments on that as well.
Yeah, it's tough. It's one of those things like what's causing the either the pain or just the mechanical adaptation. Is it the poor mobility that leads you to, an anterior tilted pelvis, which is causing you to arch your lower back and then you're extended, and now, not only is that going to affect your ability it could lead to some back discomfort, but now you're not going to be able to rotate as efficiently because your rib cage isn't stacked over your pelvis and you're not in a good neutral position. Okay. So just trying to understand, what we'll do with a bunch of pitchers that present with those things is have them breathe and have them feel, their pelvis being stacked over the rib cage before executing a throw, and then trying to move through that that like new range or that new position while executing the throw, and can you maintain that?
Okay.
Yeah, and Gabe, I think that's why, and a lot of pitchers probably hit a good exhale, before they throw. You might see a lot of pitchers like on the mound, like take a good inhale, good exhale, and then they go and throw. If you're in a good exhale position, you're going to be able to rotate a lot better. So like you're not going to be fighting if you just like really arch your back and try to rotate. Like you're not going to be able to rotate. Whereas if you exhale and get your cage down, now you're going to be able to rotate a lot better. Now you're not fighting yourself. So like it's definitely probably one of those reasons that's causing some of that annoying tightness. We've all been there, so we all know how you feel.
Yeah.
All right. Yeah, that makes sense. Thank you.
Yeah, buddy.
Thank you too, George. Appreciate that.
Yeah, man.
Cool. Well, anything else, Barry? Got anything else for me before we sign off?
No, I don't think so. I was gonna ask you about PRI, but you mentioned the postural breathing several times throughout the presentation, and also how, and George mentioned how he might have some pitchers do something similar to that before they throw to ensure the rib cage is in the proper position, and as you mentioned, it'll allow the athlete to rotate more effectively.
And just to build off of that, that's where something that's super, super important that, Rob, we've done an okay job. I think we could do a better job of tying in moves that will go on upstairs with Rob to tie them into pitching and tie them into the context of the sport. Because if you're doing exercises that, your positional breathing stuff upstairs and it's sort of in a vacuum and it doesn't get to your actual sport, I mean, yes, it's important, but where's the transfer? So, in order to drive better transfer and overall just better learning, incorporating those positions and those cues through multiple mediums is really something that, I've tried to work on the throwing side.
Yeah, no doubt. I think it's just going to help the person learn. They're going to learn. They're going to hear it from me. They're going to hear it from you. So like just from a learning standpoint, I think it's definitely going to help. And then just like the outcomes are going to be better too, because we have the same message then. And that's something that the athlete wants to know, that everyone's on the same page and agreeing with